So Peyronie's disease is a disease process that affects the penis, causing the penis to curve. It can be curving in either direction or even upwards. This is as a result of the formation of fibrous tissue, which is pretty much like scar or like plaques, as we call it, in certain parts of the penis, and that can affect the erectile function of the penis as well. So in terms of when we think of Peyronie's disease, we think of the causative factors. Some causative factors can be age. Middle-aged men tend to be affected. 10% of middle-aged men suffer from Peyronie's disease. It can also be lifestyle factors, genetics, and some some diseases affecting collagen formation. So among the things that which would be the symptoms of Peyronie's disease would be erectile dysfunction can accompany Peyronie's disease. There would be like a curvature of the penis, which tends to get worse with time. At times it can also stabilize, and at other times the curvature of the penis is so severe that intercourse is pretty much impossible. There is also pain upon erection, which is in the early stages of the disease, and that is where people tend to need to be very mindful of. The disease is modifiable more so in the early stages. That is when you have pain upon erection. In terms of what can be done, what treatment modalities are available in the UK, we have pump or penis extenders, which tend to stretch the plaque and prevent the plaque from contracting, which tends to eventually shorten the penis when that happens. So these extending devices, they tend to stretch the penis and prevent the shortening of the penis. And we also have what we call the P-shot, which is platelet-rich plasma re-injected into different parts of the penis, which is initially the erectile tissue and eventually into the plaque, which tends to reduce the curvature of the penis after subsequent treatments. So it is very important to stress on the fact that one single treatment is not going to treat Peyronie's disease, but it's more of a marathon where you tend to have multiple treatments, and that tends to improve or reduce the curvature of the penis with subsequent treatment. What could men do to improve their chances when they are affected with Peyronie's disease is pretty much the lifestyle factors that would affect anybody if they tend to be affected with erectile dysfunction. So exercising at least 3 times a week for a minimum of 40 minutes each time of some sort of strenuous physical activity, which will at least make you out of breath to the point that you can't speak in complete sentences, reducing the intake of alcohol, stopping smoking, and trying to lose weight if you carry a little bit more weight than you should.